I don't think anybody on this panel, where all physicians are going to disagree with you, that there is an epidemic of obesity, heart disease, diabetes in this country, and that fruits and vegetables and decreasing some known carcinogens is a really good idea. But I think as physicians, we had a long discussion about this backstage, about the way you chose to present the science, or kind of the way it was presented in your documentary, as if more like a scare tactic, as a conspiracy theory. For example, with the World Health Organization, when you talked about carcinogens and you equated red meat to basically tobacco and smoking and said that it was equivalent in the World Health Organization, I think it was a misrepresentation of a lot of the science. You're not actually looking at level of risk.
I have to apologize to interrupt, but I kind of saw a little bit of a void and of confusion, because as much as meat has been classified that, certain processed meats more than any others, you know, the sun is classified as a class group 1
and that's
carcinogen. So is red wine, and so I find it very interesting that if we're going to talk about that, you know, and say that all meat is bad and it's toxic, it's just so unfair, because there's a huge difference.
I'm not into opinions. I'm into actual science, and I'm not biased because I'm vegan. I'm vegan because I learned this stuff through science. I wrote a book telling people to eat protein. I'm a weight loss doctor. I was telling my patients to eat protein. They were getting fatter. I was getting fatter. I failed a life insurance policy.
No, protein is great, and so are vegetables. I don't think
protein is not great. That's the problem. And so this is not, but see, so I wrote a book where I really went crazy trying to figure out, why am I ill? Why is everybody ill? Why do I have a room full of patients that are sick? When I say that there are a lot of studies linking meat to cancer, there are a lot of studies. So in 2004, the American Institute of Cancer Research, the World Health Organization, and the World Cancer Research Fund did a humongous study, and you got to read the prologue, because they say, we have differences of opinion, but the opinions we put here are unanimous. After reviewing 800 studies, we tell you to only eat 2/3 of a serving of meat a week. In Okinawa, they have 80% of their calories from carbohydrates, 80%.
But they eat meat.
They eat pork once every 2 to 4 weeks.
You were so off on the science, in my humble opinion, because you say sugar doesn't cause diabetes and that carbohydrates don't cause people to be fat, and then you use science and you said that 80% of Okinawans eat rice as their primary carbohydrate. No. That's just not true.
Dr. Davis, we all know as physicians that there are so many studies out there, and everyone can cherry pick one research report, one study.
So why is the World Health Organization studying 900 studies and they're cherry picking?
Look, at the end of the day, what's so crazy about this is I actually agree with almost everything you recommend, Dr. Davis. Right. That's what's so crazy. I actually, you know, using beans in place of meat is a great option, primarily plant-based diet and reducing disease. But let's get back to science. You're saying that Okinawans eat 80% of their diet is rice? It's not. It's actually sweet potatoes.
It is sweet potatoes, and that's what I say in my book, and that's what I said in
I have a quote
in the film, though.
I have a quote, and then you cite the rice diet from Duke, my alma mater, and the truth is that it's such a low-calorie restrictive diet.
It is not a low-calorie. This is unbelievable, because this is the most unscientific discussion I've ever had in my life.
Why don't we get some?
Am I on the doctors or am I on some kind of show? Seriously, guys, stop for 1 second. That is not science. That's a lie, Travis. And what you are doing is lying to this public, and that's why I got to treat them after they get sick.
I read everything on it, and then I read your quotes, and I disagree with you.
Travis, I can make you diabetic right now with a euglycemic clamp and an infusion of fat.
Let's talk so people can understand.
Let's talk about the science.
And I don't disagree with that. Again,
you don't disagree with that.
I don't disagree with too many calories are going to make you obese and potentially cause diabetes. You say excess sugars or simple carbohydrates will not lead to diabetes or obesity. But the statement is patently false that sugar can't cause diabetes or obesity. You can't make those statements and then expect the scientists to agree with you.
Tons of science to support it.